Okay, let's continue talking about the analytic observational studies. And now we're going to talk about the case control studies. So in case control studies, the investigator begins with cases and controls and then goes back retrospectively to look for exposures. So case control studies by default are retrospective studies. In a case control study, the investigator must first identify a group of individuals with the outcome of interest, which will be considered cases. A second group is identified without the outcome of interest and will be considered as the controls. Cases and controls can be matched individually or as a group for variables that might cause confounding, like matched for age, gender, and ethnicity, or they can be unmatched. So we have two types of case control studies, matched and unmatched. If unmatched, then each group should have some similar characteristics. The proportion of those cases that have a history of exposures is then compared to the proportion of the cases that were not exposed. And the proportion of the controls that were exposed will be compared to the proportion of the controls that were not exposed. And the measure of the effect of exposure is expressed as an odds ratio. So this table shows the calculation of the odds ratio in a case control study. So again, we have the vertical columns, cases and controls, the rows for exposure history and no exposure history. So the proportion of cases exposed will be A divided by A plus C. And the proportion of controls exposed will be B divided by B and D. And the odds ratio, if we're doing unmatched study, will be AD divided by BC. Whereas if we're doing matched study, it's going to be simpler than that, just B divided by C. B divided by C. So the odds ratio is the ratio of the odds of having been exposed if you are a case to the odds of having been exposed if you are not a case. If the exposure is not related to the disease, the odds ratio will be 1. If the exposure is related to the disease or the outcome, the odds ratio is more than 1. If the odds ratio is less than 1, then the exposure is considered protective. Like you take patients who have heart disease and you go back and ask how many of you did exercise. So the exposure to exercise reduced the risk of heart disease. So to summarize, in a case control study, if there is an association between an exposure and disease, the history of exposure should be higher in persons who have the disease compared to those who do not have the disease, the controls. It's important to keep in mind that the odds ratio is not a calculation of risk and cannot predict which exposures or risk factors will develop into a case or disease. And the fact that a person is obese, for example, may put that person at risk for diabetes, but it does not mean that that person will actually get diabetes. It's just at risk for diabetes. So in case control studies, one cannot control the relative risk. Therefore, we cannot conclude that if you are obese, you will develop diabetes, but rather, if your odds ratio is greater than 1, you could conclude that those with diabetes are more likely to be obese. So because you start with the condition and you go retrospectively or backwards to assess the exposure or the risk factors. Okay, I'm going to devote the coming segment for talking about the interventional studies, the randomized controlled trials.